it felt like you're a hamster in a spinning wheel, but you're not going anywhere. It's just a broken system. And the longer I practiced in that system, the more I could see that as much as I wanted and desired to help these people, it wasn't working. There's a wonderful new, I would say newer division of science called epigenetics that I became very interested in, which is how can you change your genetic potential? And for me, that led to this lifestyle medicine, integrative medicine. And when I found that HELPcare was doing that very well, where they're saying, this is your metabolic profile in your labs, and here's a plan of how we can walk alongside you with a coach. We can help you lose weight. We can help you improve your metabolic numbers, not just through medication, but through lifestyle change. I became very, very interested, and that's what led me to pursue essentially packing up the bags in California and moving cross country. I would definitely 100% recommend HELPcare as a place to work. And it's a wonderful opportunity. I think that being able to trade that rat race kind of a system where you're just, churning the patients and not really feeling like you are helping them as well as you could, and you want more. There's a wonderful experience here at HELPcare in that we have the time with each patient. We have enough time to be able to really dig into their biggest issues and start to formulate a plan and work on that and chip away at it. And we have the freedom to try new things. We have the collaboration already in place. And then you have Lee and his team who have set up the administrative side so you can start your practice and have a piece of ownership that I personally would have never gone out and done on my own. And I think that if somebody were to come to me and say, I'm burnt out in the traditional system, I would say, come join us. This is the place to work because you're not going to feel that way. You're going to have time with each patient. You're going to have support that you need. If you need additional resources in some way, they're going to back you up. And I just think the collaboration, again, that we've already got and the systems that we've already got in place are going to help any future providers to feel even more at ease coming to join us.
We are delighted to welcome to the Take Charge with HELPcare podcast, Danae Boorsma, who is the newest nurse practitioner who's joined with the HELPcare Clinic practice in Austin. We're even more delighted that she's joined us in the practice, but glad to have her with us here today. And so Dan would love to have you take it away and help our audience get to know her a little bit better.
Yeah, welcome to the podcast today. It's great to have you here. Let's start by just asking you to share with us a little bit about your history. Where did you grow up? Something about your education, anything about your family that you'd like to share?
Yes. Well, I like to think of myself as a Midwesterner because I did grow up in Wisconsin and lived there until going to college in the Twin Cities area in Minnesota. It ended up actually in Rochester for my nursing degree. I followed my older sister there, and that's where I met my husband. So I became a nurse. I worked at Mayo Clinic for a little while, and we decided we wanted to adventure as a young newly couple. So we packed our little vehicle up with all of our belongings that we could fit in it, and we drove cross country to California. My husband at the time was pursuing music, and we felt like California would be a good place to do that, and thought we'd move around a bit, and got stuck there for 16 years. So that's where I became a nurse practitioner out there at UCLA. And I went to the family nurse practitioner program and worked in the underserved population at the county facility there for a number of years before transitioning into more of women's health and primary care in the virtual space for a few years while my kids were little. And eventually, we decided the Midwest was calling, and we moved back to Minnesota last summer to be able to join HELPcare and kind of come back to in-clinic care. So and as far as a little bit about myself and interests, I would say that I enjoy the outdoors in any way, shape, or form. And so that was something I had to sacrifice a little bit in coming back from California, was how would we adjust to the seasons again? And it's been a joy to find that the changing seasons have been really fun for not just for me, but also for my kids, and showing them the snow and how you can get outside even if it's raining. And so hiking and biking and running and all of those things.
Great.
Yeah, I'll also just share a little bit of how Danae came to work with us, because her mom, Sandy, was one of our founding members back in 2022 uh, my wife Lisa and I got to meet with Sandy, and we were doing some health coaching with her, and she said, my daughter's a nurse practitioner out in California. And we kind of said, oh, well, that's great, But then it was maybe 6 months ago. Well, actually, it was April or May or something like that of this year that got an email from Danae saying, we've been kind of thinking and praying about whether it's time for us to be moving back to the Midwest. And so the rest, as they say, is history. I mean, it's worked out really well that she was able to join us at a time when we had some significant growth happening here, and especially some significant growth on the horizon. And so she was able to start with us in October. And then when we had the big surge of first of the year new members with a few of the employer plans, she's really stepped in and has done great work with.
So I heard you say you had a calling sort of in your heart. You wanted to get back to the Midwest, but why HELPcare instead of, say, a different Mayo Clinic or somewhere you had previously worked?
Yeah, great question. So as Lee said, I first heard about HELPcare through my mother and her experience as a patient. And I became curious simply because she said, oh, it's a different kind of healthcare. And I don't even think she used the word direct primary care necessarily, or if she did, I didn't catch it. But that term kind of started to trickle into my vocabulary, so to speak, through different experiences. I have a sister who's also in family medicine over in the Milwaukee area, and she started learning about direct primary care, and we had talked about it at one of our holiday gatherings, I think. And when I realized that it bypasses traditional insurance, it just became like the lights went on. I think it happened around the same time where I had struggled as a primary care provider in the traditional system right after the pandemic. We had such a huge influx, or I should say backlog, of patients needing to be seen because they had been deferred during the pandemic. And then it compounded the brokenness that was already there. So we could see that there were no space for specialty care. So we would establish care and set out this plan, and sometimes they would need to go to whichever specialist. They can't get in for 3 months, and they also couldn't get in to see me. And so I did all this work, and then they couldn't get back to see me to make progress in the way that traditional system is set up. You really have to check in frequently. And, it felt like you're a hamster in a spinning wheel, but you're not going anywhere. It's just a broken system. And the longer I practiced in that system, the more I could see that as much as I wanted and desired to help these people, it wasn't working. And at the same time, things happened in my own personal life where my father had been diagnosed with ALS and went through just a really dramatic, ultimately fatal disease process where he was completely healthy one day, and 9 months later, he passed away after losing all of his bodily functions. And all the research that I could do and find about how do you treat this disease was there's no treatment, except in that sort of functional and integrative medicine space where they said, we think these things can slow the progress. And there's a wonderful newer division of science called epigenetics that I became very interested in, which is how can you change your genetic potential? And for me, that led to this lifestyle medicine, integrative medicine. And when I found that HELPcare was doing that very well, where they're saying, this is your metabolic profile in your labs, and here's a plan of how we can walk alongside you with a coach. We can help you lose weight. We can help you improve your metabolic numbers, not just through medication, but through lifestyle change. I became very, very interested, and that's what led me to pursue essentially packing up the bags in California and moving cross country.
Yeah. So the interest in HELPcare came first, and then the move was followed because of your real attraction to HELPcare.
Yes, definitely.
Very interesting.
People are coming from all over the country to be part of this.
So, okay, so contrast for us the difference then between the system approach and the healthcare approach. You've already described it somewhat about the metabolic focus, but how about the patient care?
Yes. Well, I mentioned, feeling like I was a hamster in a wheel, because you really are, and as a patient, you are too. You get there. There's long waits. You finally get in to see your provider, and then you've got 5 or 10 minutes to say what you want to say. And as a provider, you're hardly getting a chance to really evaluate their labs or talk with them about their condition, because there are so many patients to see in one day. So those quick impersonal visits, they didn't work for the patient. The patient didn't get to say what they wanted to say or feel heard. And it didn't work for me as a provider, because I want to hear you as a patient, and I want to understand where the real problems are, because I know that if your lifestyle is not great and you're not motivated to change, there's something behind that. And unless we have time to talk about it, we're not going to get to the bottom of it and really start to affect change or motivation. So I think that was a big piece in wanting to pursue a system that wasn't constrained by those visits, where you're saying the more visits we get the patient to make, the more money we make as a system. So in a direct primary care system, we're saying the healthier we can make you, the better off we are together. We don't have to have a lot of visits to make it as a business or to help a patient be healthy, when we have enough time to really hear and answer the questions that need to be asked.
So I like this. Can you think of a patient experience that kind of illustrates this model and how you're able to help patients in even better ways?
Yes. Yes, I can think of a patient who came in when, she'd been having symptoms for several years, and her symptoms had been dismissed in the traditional system. She felt very dismissed, felt that, she had symptoms of brain fog, symptoms of abnormal heart rhythm and heart rate, rate variability, and just generally not having normal energy levels. And so when she came into established care, we do a very comprehensive set of labs and look through things. There was no thyroid problems, no major evidence of disease on those labs. But when we talked through her symptoms and had that hour-long visit that we do at the beginning, it became evident that something more was going on. And I thought that the symptoms seem to be most consistent with a condition called POTS. And this can cause the heart rate variability that she'd been having and the brain fog. And in a traditional system, you have to send this person off to a specialist, usually a cardiologist, for more intensive testing, like tilt table testing. And, oftentimes it'll take 3 months to get in to see that person before you finally get an answer. And usually the answer is, here, take some beta blockers and we'll just kind of slow the heart rate down, and that way you won't feel the variability and maybe you'll feel a little bit better. But in talking with my colleagues, specifically Dr. Strobel, and doing some more research, we found that there were some tests that we could do in clinic. And I honestly don't think I would have had the time to collaborate as much as I did, but also do the research for this patient if I were in a different model where I was seeing the patient for 10 minutes. I probably wouldn't even come to the conclusion that this could be POTS if I had 10 minutes with her. But then to be able to say, you know what, because she was not willing to go back to the traditional system, and she didn't have insurance to be able to, or the cash funds to be able to see a cardiologist out of pocket, we said, let's go ahead and try this clinical test in person and see if we can establish that diagnosis, which we did. And then we were able to give her some resources about how she could do dysautonomia rehabilitation through things like vagal nerve stimulation, humming, and some YouTube videos that were helpful that we found.
And what is the biggest way this benefited the patient, that process?
I think we saved her time and money, and we were able to answer questions, much faster than if she had to wait for a specialist. And in the end, giving someone ways that they can help their body to heal instead of just another medication is the biggest benefit.
I think that's a really great point, because I think, primary care has gotten kind of pigeonholed, I think, in the big systems, where they're kind of the gatekeeper and they're the referral to other specialties. where primary care is capable of doing a lot more. I mean, Danae talked about this case of the patient with POTS. I had the example of I had a basal skin cancer, and we're able to, instead of having to refer to a dermatologist and then have all that was able to be removed within the clinic here, as just part of primary care. And maybe wouldn't want to do that with a melanoma, but with a basal skin cancer, it was a pretty straightforward, simple thing to do. And as she mentioned, we have lots of patients with different levels of insurance. And so the ability to pick the right kind of treatment that the patient wants and is able to afford really is a meaningful difference, I think.
Great examples. So are there other things you love about working with HELPcare?
Definitely. I love working at HELPcare. I think we work very well together as a team, not just within the clinic, but between the administrative partners and the leadership team. And everyone really cares for one another and cares about the clinic as a whole in a way that, I have never seen elsewhere. I think it stems from all of us having the same goals in really wanting to provide good care for our patients and doing that in a way that is truly a ministry for us. We're not just invested because this is our hourly job or to bring home a paycheck, but we really want to see that there are good outcomes that come from each patient visit. And I think that even among the nursing staff in the clinic, everyone goes above and beyond to make sure that patients get the care they need, whether it's collaborating, even talking about their own experiences to help with that sort of answering the question.
Lee, is there anything you do within the organization to help these things happen? Just naturally, people collaborate and get the support they need.
I think there's something with the size, that, we are not a large clinic. We're getting larger, which we're happy about. But I think kind of the idea of, when we have 1,800 patients together between the Austin and Rochester, clinics right now. And with 4 practitioners, that means that you have more, relationships that are closer and more natural versus, that if you're an organization with 1,000 doctors and with 3,000 nurses, there's something about that more human level of scale versus an industrial level of scale. And that isn't to say that we don't have aspirations of being able to help a lot more people, but I think the way we do it is by putting little clinics in lots of places that are owned by the practitioners themselves so that they have that stake to say, I want to be able to practice the way I'd like to practice and the way that I feel called to practice, instead of what's driven by, some guidelines or what some administrator said. It is the practitioners that run the clinic and it's their practice. And then on the HELPcare side, we're just there to help facilitate that and to help make that work from a business perspective so that they can have the kind of career experience and life experience and provide the kind of care that they really, really want to be able to do.
Definitely. I would echo that not only the ownership is a motivator, but the support that I feel as a provider in being able to come up with an idea and being told, okay, investigate that, run with it, let's see how that works. Or even as a provider to my patient, I have this idea about how we could go about further investigating your gut issues with a GI map test, but I'm still learning. And would you like to learn with me? Instead of feeling constrained by, well, we've never ordered this test before, so we're not going to start, that kind of a response that you would probably normally get.
Well, I'll just say that's also super refreshing from my perspective as well, because I worked in a very large medical system where there was a committee structure for everything that you needed to do. And, to be able to get an idea or have a practitioner get an idea and to be able to say, let's try it. Let's, if it seems reasonable, then let's see if that might create a whole new opportunity for a service that we could offer for others too.
So, Danae, what advice would you give a practitioner who might be a little frustrated in their current role, might be looking for something else, and came to you, and what advice would you give?
Yeah, well, I would definitely 100% recommend HELPcare as a place to work. And it's a wonderful opportunity. I think that being able to trade that rat race kind of a system where you're just, churning the patients and not really feeling like you are helping them as well as you could, and you want more. There's a wonderful experience here at HELPcare in that we have the time with each patient. We have enough time to be able to really dig into their biggest issues and start to formulate a plan and work on that and chip away at it. And we have the freedom to try new things. We have the collaboration already in place. And then you have Lee and his team who have set up the administrative side so you can start your practice and have a piece of ownership that I personally would have never gone out and done on my own. And I think that if somebody were to come to me and say, I'm burnt out in the traditional system, I would say, come join us. This is the place to work because you're not going to feel that way. You're going to have time with each patient. You're going to have support that you need. If you need additional resources in some way, they're going to back you up. And I just think the collaboration, again, that we've already got and the systems that we've already got in place are going to help any future providers to feel even more at ease coming to join us.
Thanks for sharing that. And Lee, do you have anything else to add?
Well, I just say that, this really has been a family thing with Danae too, because Sandy, who was one of our founding members, is now one of our receptionists. So there really is a family feel, and that actually, I think, contributes to some of the, personal relationships and closeness that you have and the cohesion that we have, among the staff, where we really care for each other and support each other in being able to then better serve the members, the patients. And so it's just been a joy to have Danae. Glad to have her with us, and she's really been a great addition to the team, and just an example of the kind of practitioner that we'd like to have, that we'd like to help support in the same way. As I mentioned, our goal is to have other clinics and other places too. And so for people who are like her, and like our other practitioners who say, I'm tired of being on that treadmill, in that hamster wheel. So we want to help people take charge of their health. We also want to help practitioners take charge of their career. Too often we make decisions by default. We just do the next thing because that just seems like that's what everybody does. And what we're trying to say is that there's a different way. There are options, and we can, together we're helping to create a model that's really attractive for the practitioners, and also the thing that the patients have been yearning for. I mean, they really miss what they used to have. Some of them have never experienced it. They're not old enough to have experienced it, but to have a doctor that they know, a practitioner they know who knows them, that's super meaningful.
Well, Danae, thanks for joining us on the podcast today.
Thank you for having me.
Thanks for joining us, and thanks for joining us. We're so glad that you're part of what we're doing here.
Thank you. I'm very glad to be a part of HELPcare, and I'm excited to see what the future holds.
Thanks for joining us. If you enjoyed this episode, be sure to leave a comment or a review, and to subscribe on Spotify, Apple Podcasts, or on YouTube. And also to share Take Charge with HELPcare with your friends and on your social media channels. At HELPcare, our passion is helping people take charge of their health and their health care, helping employers take charge of their health plan expenses, and helping physicians and other practitioners take charge of their healthcare careers. Learn more about the HELPcare Clinic difference at helpcare.health.